Okay, here is our topic for tonight. We are going to talk about preventing dementia. A little word about myself. I'm Mana Sembi. I am a naturopathic doctor. I graduated from Bastyr University, California. Before I joined the clinic here in San Diego, Encinitas, I worked at a cancer center in Irvine, worked in integrative oncology as well as primary care. At the same time, I also worked with patients with different stages of cancer, mostly stage 3 and stage 4, in a support group. And that was an interaction I enjoyed very much. While I was at the cancer center, I also trained in the Bredesen 2.0 protocol on reversing and preventing Alzheimer's. Since joining the clinic here, I've been fortunate to work with many patients who have been diagnosed either with dementia or with Alzheimer's, and also with those patients who are proactive about wanting to prevent dementia. And it is a very rewarding experience for me, just seeing patients understand what needs to be done and putting the plans into place and seeing improvements in their health over a period of time. So a little bit about you. I won't have a chance to ask all of you individually as to what brings you here today. But if I were to guess, this would be a self-assessment for the patient population today. You either have a family history of dementia, or you know your own personal genetics, your ApoE status, and you're concerned. You've experienced some concerns about your memory, your planning, organizational skills, or you feel something is wrong with your health, but you're not sure what. Perhaps you've noticed a decreased desire in being socially connected, or you're noticing changes in your overall health, mental health, and your overall health. Or maybe you've noticed some irregularities on your labs in the last several months. And perhaps none of these is applicable to you. And if that's the case, special kudos to you for being proactive and jumping on this webinar today to learn what can be done. The topic of preventing dementia is especially close to my heart because so many people do not know that this is a condition that is entirely preventable. And even if you get dementia and even Alzheimer's, depending on what stage you're at, there is a lot that can be done to reverse. If somebody comes in at the very end stage of Alzheimer's, it may be a little bit more challenging, and the improvements that we see may be not dramatic, but there are still things that we can do to support them where they are. So that's why it makes it really important for us to focus on preventing dementia, because in the early stages, there is so much more that we can do. This is a graphic that is helpful to just set the stage for our chat this evening. And just a little bit about how we'll structure our conversation today. I'll talk for about 40 to 45 minutes, and I'll go through my presentation. And then I will open it up to questions from you, and I will try to answer to the best of my ability. Please go ahead and put your questions into either the chat box or into the Q&A. I will not have a chance to look through those while I'm presenting, since this is a live webinar, but I will have a chance to look at those questions and answer some of them after my talk is over. About Alzheimer's. And the reason I'm focusing on Alzheimer's is simply because this is the kind of dementia that has been studied the most. This is the one that Dr. Bredesen focuses on. This is the protocol and the whole program that I am trained on and that I work on people with. Now, 70% of dementia is Alzheimer's dementia. So we can kind of project based on these figures as to what the numbers for overall dementia might be. It says here that more than 6 million Americans are living with Alzheimer's today, which makes it about 8.5 million people that have a diagnosis of some form of dementia. 1 in 3 seniors dies with Alzheimer's or another form of dementia. And this is especially significant. Alzheimer's kills more people than breast cancer and prostate cancer combined. And then finally, one other statistic that I want to highlight from this graphic is in the last 20 years or so, there has been a decrease in deaths from heart disease of about 7.3%. But the increase in deaths from Alzheimer's has skyrocketed 145%. So it really behooves us to understand what is going on and what we can do to change the trajectory of our health so we don't go down this road. Some of you may be aware that there are 4 stages of dementia, and this is really important to understand because the kind of intervention we need to do and the kind of reversal and the kind of results we can see at different stages can differ a lot. So it's really important to understand what are the 4 stages of dementia. The first one is a pre-symptomatic stage. This is where a patient may or may not have any symptoms. They may not yet suspect that something is wrong, or they may have a little bit of a sense that something is up, but they can't quite put their finger on it. However, if they underwent a PET scan or if a spinal tap was done, we would be able to see some amyloid beta, some tau proteins, and these are the things that are found in the brains of people with Alzheimer's when autopsies are done. These are amyloid beta plaque and the tau proteins. So at the pre-symptomatic stage, you have no symptoms whatsoever or like just slight suspicion of something going on, but changes can still be seen in your brain and your spinal fluid. The second stage is called SCI, or subjective cognitive impairment. This lasts about 10 years. And during this time, it's really easy to reverse the decline. But unfortunately, people don't do anything about it because they're still not sure if something is really going on, or is it just like they are doubting themselves. So this is a stage where it's not obvious to people outside of in the family or their friends that something is going on, but the patient themselves might know. The third stage is MCI, mild cognitive impairment. And this is where the nomenclature really, really hurts us. There is nothing mild about this stage. Dr. Bredesen likes to call it like this should be like advanced stage Alzheimer's. This is relatively late in the pathophysiological process. But when you get a diagnosis of MCI, mild cognitive impairment, you might come away thinking, oh, it's mild. There's not much, it's not so serious. Maybe I don't need to do anything about it. But this is an advanced stage of Alzheimer's, and we really need to take it seriously. And finally, the fourth stage is final stage Alzheimer's. Typically, people are diagnosed at this stage. At this point, they are losing the activities of daily living. They can no longer take care of themselves. Some kind of caregiving is needed. At this point, families might decide to put their loved ones in a memory care facility or another place. But the important thing to know is that by the time that diagnosis occurs, the patient has probably had this underlying pathophysiological process going on for 20 to 30 years. So we had such a wide window of time in which we could have done something about it. But even if we knew well in time, well ahead of this diagnosis, the prevailing view out there is that there is nothing you can do about it. And that is so wrong, which is why we want to focus really on preventing dementia and raising the awareness that this is something that can be done. This is another graphic to kind of share the same information that I just went through. It just shows you that normal aging, you may experience some slight cognitive decline, and that is shown by the green arrows on the very top. It's very, very slight. You might occasionally forget a name or something that you were going to say, but generally your activities of daily living are completely intact. And we will talk a little bit more about this on the next stage. But on this slide, what I want to focus on is the column on the left, which is the preclinical stage. we just talked about that this is really what we call the silent phase. There are brain changes at this time, but there aren't any measurable symptoms. If I gave you a cognitive assessment, you would probably get, let's say, the MoCA. You would probably get between a 26 to 30, which is normal. So you wouldn't have any outward symptoms that are measurable. But if we were to do a brain scan, you would be able to see that there are already changes in the brain. Now, again, the individual may notice changes, but they are not detectable on tests. And this is the most critical thing that I want to say here. This is a stage where the patient knows, but the doctor doesn't. You can lead your life pretty much intact, but you're beginning to feel something is off, but you can't put your finger on it. Okay, this is the stage where I want you to focus on your health and say, I need to make an appointment with a doctor who knows how to help me. And even if you go through and have an assessment and everything comes back normal, well, that's great. There are always things you can do to improve your health and change the trajectory. Maybe 5 or 10 years down the road, you would have real symptoms that would be measurable, but with taking proactive steps, you can completely change the trajectory and just stay on the healthier side of things. And then on the same page here in the middle column, when it comes to the MCI, the mild cognitive impairment, the cognitive changes are now a concern to the individual and to the family. One or more cognitive domains are now impaired significantly. It is obvious to close family members that something is going on. However, your activities of daily living are still preserved. And because your activities of daily living are preserved, families sometimes still will delay getting their loved one the care they need because they are not having to do that much for their loved one. It is only when the activities of daily living get impaired and now the burden on the caregiver and the loved ones and the families is so high, and really the patient themselves is not able to take care of themselves anymore. That's when families swing into action, and then they want to do everything that is possible. And of course, we try to do everything that is possible, but we want to get the word out there that the time to address these issues is decades before we get to that stage. So anytime you feel something is off, find a doctor who's educated, somebody you feel comfortable with, and go get checked up. You probably all know about this, how prevalent dementia and cognitive decline is. But just to recap this, approximately 2 out of 3 Americans will experience some sort of cognitive impairment at an average age of 70 years. The lifetime risk for women is higher, it's 37%, and for men, it's slightly lower at 24%. So women can expect to live 4.2 years with mild impairment and 3.2 years with dementia, and men with 3.5 years with mild impairment and 1.8 years with dementia. Now, the thing to notice though is, this is roughly 6 to 7, maybe 8 years where, you don't have the one thing that most people value most highly. They lose their independence, they lose their memory, they lose the connection with loved ones, right? And for the families of people who go into this dementia or cognitive decline, it's like what's most valuable? You cherish your memories, your plans for tomorrow. Everything comes to a halt, and that's the unfortunate thing. So the point of our chat today, of this webinar today, is to say that there's 2 things basically. That dementia is completely preventable. And second, there is a lot we can do. So I want you all to come away with a lot of hope and optimism that a lot can be done. This is not something, this is not a one-way road. We can definitely reverse dementia if it begins to manifest in some ways, but we want to stay focused on preventing it. And here we have a little bit more about what you might expect in terms of normal aging, and what would indicate if this is heading towards dementia. So A person who's aging normally and is not on the, I would say, like the dementia trajectory, they would be able to function independently and pursue normal activities despite occasional memory lapses. So these memory lapses would be discrete, they would happen infrequently, and if they do happen, the individual would be able to recall and then describe their incident of forgetfulness. They may pause to remember things, they may pause to remember directions, but they don't get lost in familiar places. They may have occasional difficulty finding the right word, but they don't have any trouble holding a conversation. And their judgment and decision-making ability is roughly the same. Whereas on the other hand, individuals that are beginning to have, to show some signs of dementia would start to notice some difficulty performing simple tasks like paying bills, dressing, just their activities of daily living. And these are things that you have done many, many times, and suddenly you're forgetting to do them. Being unable to recall specific things, or memory loss causing actual problems, or being unable to describe specific incidents of forgetfulness, getting lost or disoriented in familiar places, words being forgotten, misused, garbled, repeating phrases and stories in the same conversation, trouble making choices. It's difficult to make choices. They may show poor judgment. So this is something to kind of help you discern if something that you're experiencing, like an occasional memory lapse, which way is it? How concerned should you be about it? This slide I put in here, a picture of 3 women, just to highlight the fact that dementia affects women more than it does men. 2 out of every 3 Alzheimer's patients are women. This is really important to note, and we will come back to this again and again in this webinar. So the things that we want to talk about today in preventing dementia. Is dementia a concern for you? My answer to that question is dementia is a concern for everyone in our society today. Why is that? Well, there are several reasons. We are living longer. Our exposure to toxins is much different today in the world. There are flame retardants everywhere. There's not a lot that we can do about the broader environment, but there is a lot we can do on an individual level. The second question is prevention versus reversal. Should we work to prevent dementia, or should we wait for it to manifest some symptoms before we start to work on reversal? And my thought is, of course, we are talking about prevention today, but there are cases where individuals will say, well, I don't have symptoms right now. Why do I need to do anything at this moment? I think what we have to keep in mind is that by the time there are symptoms, the brain has been changing for decades, if not years. Sorry, the other way around. For years, if not decades. And you really want to stay on top of this and kind of see, just like at the age of 45, the new guidelines are that everybody should get a colonoscopy to make sure there isn't any concern or risk for colon cancer. Dr. Bredesen likes to talk about a cognoscopy to kind of taking stock at the age of 45 to kind of see where am I when it comes to my cognitive function. And if you do this assessment and everything looks great, great. If you do the assessment and a few things are off, maybe 3 to 5 markers are off and are not quite optimal, there is something to do. If you do the assessment and there is more, well, then we put in place a more extensive plan. But I would like to emphasize the critical importance of early intervention. Timing. Again, a different way to ask the same question. Should you start working on preventing dementia in your 40s, in your 50s, in your 60s? What is really the right time? Well, to answer this question, let's just go back to the time when people are diagnosed with end stage, final stage Alzheimer's. That is generally happens late 70s or early 80s. And since we know that the pathophysiological changes have been occurring in the brain for 20 to 30 years before a diagnosis is made. Really, these brain changes begin to occur around late 40s and early 50s, which means that we really should start working on this as early as we can in our 40s. But if we are in our 50s already, well, then in our 50s. And if we are in our 60s, then in our 60s. The point is, you can't get started soon enough. You just want to make sure that there aren't any risk factors. And if there are any, you're doing what you can to mitigate those risk factors. Okay, now let's get into what are the strategies to prevent dementia. First, I want to talk about what we, naturopathic and functional medicine doctors, like to call the determinants of health. What are these determinants of health? Without these determinants in place, we really cannot build on the more sophisticated strategies that are needed. So these are the foundational strategies that we all need to make sure that we are in the best possible state of health that we can be at any given stage in our lifespan. First of all is nutrition. Your food, how do you source it? Is it organic? How many times you eat? How much you eat? How much time is there between your dinner and your breakfast? Are you eating home-cooked food? Are you getting meal plans? Are you getting it on the go? Are you perhaps reaching for some processed food? All of these things go into that, determining how good is the nutrition for you. Second is sleep. Super important. Everybody knows the importance of sleep. Not just sleep apnea, which of course we want to prevent and treat because it's directly keeping your brain from getting the oxygen it needs. Okay, so, but the quality of sleep, the length of sleep, the unbrokenness of sleep, like if you go to sleep, do you wake up many times? What is the quality of your sleep? So all these things are important. Your exercise, how much, how often, what kind of elimination you have. This is to get rid of toxins from your body, your bowel evacuation. What kind of water are you drinking such that you can eliminate toxins through urine and sweat? Your ability to manage your stress, your level of social connectedness, and just the overall status of your health and your dental care. Do you have any existing conditions that we need to know about, that we need to factor into when we make a plan for your dementia prevention strategy? Okay, now let's get into the more targeted strategies for preventing dementia. Number one is prevent and reduce inflammation. Now, where does inflammation come from? There's many sources of inflammation. First, of course, is infections. There's many sources of infections. There's Borrelia, that's a spirochete that causes Lyme disease, can cause many complications. P. gingivalis, which is a bacteria found in the mouth. From the mouth, from the gums, it's a short distance to your sinuses and a very short distance to your brain. So many times when autopsies are done on brains of Alzheimer patients, they find evidence of a lot of different infections. So we want to be really clear, if there is Lyme, we need to treat. If there is P. gingivalis, bacteria in the mouth, we need to treat. If there is herpes, we need to treat. If there's candida, we need to fix. And then there's many non-infectious sources of inflammation. Food is one. What kind of food? Are there trans fats? Is there sugar? Is there gluten? Is there dairy? Many times these two things can cause a leaky gut. So you want to be sure that your food is of good quality and is not causing inflammation. The second point that I have here is insulin resistance. If your food isn't right, if you're eating high sugar, high glycemic index food, your insulin is going to be high and your cells are going to get resistant to insulin. If that happens, what then happens is that there is an enzyme called IDE, insulin degrading enzyme. Now, if your insulin is too high, this enzyme is going to be working on just getting rid of insulin through your body. However, this is also the enzyme that works on getting rid of amyloid from your brain. But its first job is to get rid of insulin, because otherwise your glucose might go too low and you might crash. So if your insulin is high, the IDE is just working to get to reduce your insulin, and it's not getting a chance to address the amyloid that may be in the brain. How do we monitor? How do we look at your inflammation? Many different ways. We look at your CRP. We look at your albumin to globulin ratio. We might look at your interleukin 6, which is a cytokine. We might look at TNF alpha, your insulin resistance. Excuse me. Many metrics that we can use to look at inflammation and get a pretty good idea of where that inflammation is coming from. And what are the different therapies? How would we address this? Well, if there's infections, we would do targeted antimicrobial herbals and pharmaceuticals, depending on what the infectious agent is. And then, of course, with food, you would go to organic, low glycemic food. Second, you want to optimize your hormones and nutrients. And there's a long list of hormones and nutrients and other things that are called trophic factors. The trophic factors are something that help your neurons to grow. There used to be this thought that you can't grow any new neurons after a certain age. That has been debunked. You can grow neurons at all stages of life. However, how robust is that process? That is what we want to promote. So the first thing we're talking about is BDNF, which is brain-derived neurotrophic factor. This is produced when you exercise, and it helps the production of new neurons. We want to optimize your estradiol, your progesterone, and testosterone. Now, all these three hormones are found in men as well as women, of course, to different levels. And we want to make sure that these levels are optimized for your gender and your age. We also want to make sure there's enough pregnenolone, which is kind of called the mother hormone. And we want to make sure there's enough of it so that you can go ahead, your body can make the other downstream hormones for optimal brain functioning. DHEAS is another one of those hormones. I want to step to the next slide for a second because there's something very important to note here. I'm taking a break from my usual flow of the presentation to talk about Dr. Lisa Mosconi. She is a researcher in New York, and I would encourage everybody to look up her TED Talk. It's on the topic, How Menopause Affects the Brain. She's the founder of the Women's Brain Initiative, and she's the author of the XX Brain and Brain Food. And she has done some amazing research, and I want to share some of the excerpts from her TED Talk. Basically, I'll share some images that are very hard-hitting. This is a scan of a woman's brain. The scan on the left is before menopause, and you can see there's a lot of bright golden areas through the brain. Okay, on the right side, sorry, I feel that maybe you are not able to see. Let's see, maybe I'm not able to share that screen. Let's see, how can I do that? Okay, maybe I'm not able to do that. That's okay. I just want to show you. I'll just talk about those things. But I urge all of you to go look up Lisa Mosconi's TED Talk. And all the images that I wanted to share with you today are from that TED Talk. Basically, what that shows is that there was a scan of a woman's brain taken at the age of 43, which showed a very well lit up brain. And then there's a comparison, a scan of the same woman's brain 7 years later when she went through menopause. And you could visibly see that the scan was much different. And what that shows is a decrease in brain energy. When a woman goes through menopause, there is a 30% decrease in energy. And Lisa Mosconi, being who she is, she also did a analysis on the cognitive function before menopause. So there is no change to that. So we know that it's not that women are cognitively affected right as they go through menopause, although, you know, they may notice some changes, they're forgetful, or they have their mental emotional landscape is a little bit different. But there's no cognitive impact at that time, but there is a 30% reduction in energy in the brain. And the theory is that over time, this compounds and leads to women being more susceptible to Alzheimer's. And the bottom line that Lisa Mosconi is saying is that menopause occurs in mid-age, and so does Alzheimer's. It just manifests, its symptoms just show up 20 to 30 years later, which is why it is critical that women consult with their practitioners, with their doctors, and see if a bioidentical hormone replacement therapy is right for them. So now I'll continue with my next slide, coming back to the remaining hormones and nutrients which need to be optimized. Vitamin D, it's a hormone. Not many people know that. So we need to make sure it's a good level. When you look at a conventional lab, you will notice that the ranges are very, very wide. If your level is over 30, a conventional lab will say you are within normal range. And a lot of doctors will say, this is it. If it's within normal range, you're fine. However, doctors like us who are trained in optimizing your hormones and your nutrients and your markers, we know that a very wide range does not serve us does not serve anybody. What we need to do is know what is the optimal range, and that is always a much narrower range and generally on the higher side, although sometimes it can be on the lower side, depending on what the marker is. So vitamin D levels need to be optimized. And vitamin D is critical in the functioning of so many different systems in the body, including the brain, and the digestive system, your bones, and many different parts of your body. Your folate needs to be optimized. Your thyroid function is critical, and we need to check not just TSH, which is what just conventional labs will check. We also need to check your free T3, your free T4, your reverse T3, your antibodies. We need to make sure that we are looking at the thyroid from all possible angles. We want to look at your adrenal glands. Is there any cortisol dysregulation? Are you able to handle stress well? If not, what do we need to do about it? We need to look at your level of homocysteine. A higher level of homocysteine means it's also a marker of inflammation and directly related to your cardiovascular health. So we want to make sure that we are looking at all these hormones and nutrients and optimizing them for the stage that you're at, the age that you're at. So some of the labs that we will do for this include a full thyroid panel. We might do an adrenal and ASI test, adrenal stress index. We will look at your female and male hormones. We will look at your vitamin D, your MMA, your vitamin B12, your RBC zinc, selenium, glutathione. And then wherever there is a deficit, we will work to fill that gap. Okay, and then what we want to do is kind of keep track of that over a period of time to see what is coming back online in the proper range, and then we can begin to take you off of some of those supplements and medications. And finally, eliminate toxins. There are many different kinds of toxins. There are heavy metals. Mercury comes from fish, if it's not organic, wild caught, and certain kinds of fish that are less prone to having a mercury accumulation. A lot of people have amalgams in their mouth, and what they don't know is that the silver fillings are really mercury fillings, and they have mercury and tin. So those need to be replaced by a biological dentist in a very, very careful manner. You may have an imbalance of copper as compared to zinc. So that's another thing we need to address. You may have levels of arsenic. Arsenic is in our groundwater. Many people can have high levels of arsenic, even lead. All these things need to be first diagnosed. We first have to check for them. Are these high? If they are high, then we need to figure out how are we going to address them. There are different ways to do that, and definitely be done. The second category I want to talk about are mold toxins. These are mycotoxins, and they come from things like Aspergillus, ochratoxin A, penicillium, stachybotrys, which is black mold, many different species that create mold toxins. And this mold toxicity can create so many problems in the body, so many neurological symptoms, so many digestive symptoms, so many symptoms which are unrelated, and you would never think they're coming from the same one source, but this can happen, and it's actually quite common. And finally, chemical toxins. These are coming from either gasoline additives, or from glyphosate, or again, from groundwater. A lot of patients that we test come up high in chemical toxins, and then we need to make sure we create a plan that they can detox from all of these toxins. So how do we look for these? We do lab testing for heavy metals, either quicksilver or doctor's data. We will test for mold toxins through probably real-time, but even Great Plains labs, or chemical toxins, again with GPL. You want to make sure that your copper to zinc ratio is correct. Zinc is critical for insulin synthesis, for storage and release. And if your copper to zinc ratio is off kilter, you can have a lot of inflammation and also toxicity. Some of the therapies that help with eliminating toxins include regular saunas, making sure you have regular bowel evacuation at least once or twice a day, eating cruciferous vegetables, using detox agents like glutathione, NAC, and other things like that. Okay, so those were some of the strategies that we want to address. Okay, we want to prevent inflammation, we want to optimize hormones and nutrients, and then we need to eliminate toxins. Okay, so once that is out of the way, how do we screen for dementia? How do we know if there are concerns? Generally, for people who are not showing any symptoms at all, we will do a baseline series of tests, and a few things will be out of range. You know, maybe 3 to 5 markers will be out of range. And that's a pretty good place to start on, which means that things are generally under control, and we can start to address those few things that are a little bit off, and just kind of keep tabs on that. Just touch base every 4 to 6 months, make sure everything is still good. Does anything need to be changed? And we just go like that. So for screening, what we would do is we would probably check your genetics, your ApoE status, because the ApoE, the status can be ApoE2, E3, or E4. E4 is generally implicated most commonly with Alzheimer's, but that doesn't mean that 2 or 3 cannot develop symptoms of dementia, especially if there is a toxin load. So we want to make sure we're looking at your genetics. We want to look at your markers of inflammation. Some of them we already talked about earlier. We want to look at any infections. Generally, these infections are stealth infections. You don't have overt symptoms. But we need to look for to see, are there smoldering infections that are not causing big symptoms that would cause you to sit up and take notice. But these are smoldering infections. They might be in your mouth. They might be elsewhere in your body. It might be herpes. It might be CMV, EBV, different kinds of viruses that are implicated in various kinds of dementias. We will look at all the markers we've talked about: homocysteine, magnesium, selenium, glutathione, fasting insulin, your hormonal status. We will look at your toxic exposure, the state of your immune system, your microbiome, whether you have a leaky gut and gluten sensitivity. And chances are, if you have a leaky gut, you have a leaky brain, so that there might be a disruption of the blood-brain barriers. We need to look at that. We need to look at your BMI. We need to look at imaging, and we might do an MRI with volumetrics, a neuroquant, which tells us if there is any shrinkage in the size of the hippocampus in your brain. This is the area where memory is processed. So if there is a shrinkage in this area, it's a direct confirmation that the process of dementia is well underway. We need to screen for sleep apnea, super critical to make sure this is diagnosed and addressed if it is a concern. And of course, then we would do cognitive assessments like the Montreal Cognitive Assessment or the Mini Mental State Examination, MMSE. These are non-invasive oral tests that we can administer in office easily. Okay, and then how do we monitor status and progress over time? The first thing to do is to create a trusted team with a Bredesen-trained doctor and a health coach. Okay, you will do your initial labs, a cognitive assessment and a consult, and then hopefully the team will create an ordered list of things that need to be addressed, in the order of importance. So if there are, let's say, 5 things to be addressed, you have your doctor put them in an order in which they should be addressed, so that one, there is not too much stress, not too many supplements to take, and that everything is managed, easily managed, okay? And then, but if there's a longer list, if there's, let's say, 10 things to do, then of course there's more things to stay on top of, more supplements to take, more changes to implement in your lifestyle. This is where working with a health coach is really, really handy. They can help you create schedules for your food, for your supplements, for creating the changes that may be needed in your life. Okay, then you would implement this treatment plan for 3 to 6 months, working with a health coach or with a loved one or by yourself if you are independent and you don't need any help. And then you would follow up with your team for repeat labs and cognitive assessment, as well as review changes in your symptoms. How do you feel? Do you feel you have a better handle on things? Do you feel less concerned that you're heading towards dementia? Are your markers looking better? Are your labs looking better? Okay, and then you would implement the updated treatment plan as needed. And if all is well and there isn't much to do in terms of changing lifestyle or diet or adding in supplements, then you would continue to follow up once every 6 months or so as needed. If things change, of course, you can follow up more frequently with your team. Okay, and this is just acknowledgements. If you have not read the book, The End of Alzheimer's, by Dr. Dale Bredesen, I highly recommend that you do that. And now I am open for your questions. So I'll go ahead and take a look. Okay. Okay. All right. Great. We have people from Ohio and Colombia. I do not speak Spanish and I do not read it, so sorry. Hi, Betty, Texas. From Hawaii, great. If dementia runs in your family or husband's family, definitely children need to be checked. Maybe your husband should get a checkup. Hi to everybody from Savannah, Georgia, New Jersey. Okay, anybody that has family history of Alzheimer's, definitely stay on top of this. People from Nevada. Okay, Texas. Okay. Somebody, a comment is here on the role of, comment on the role of high fructose corn syrup. Definitely, that has had a big impact on the collective metabolic health of the country. And things are beginning to change now, thankfully, but the damage has been done. And yes, you're right that the hippocampus is a glucose-sensitive part. Okay, just turning around to if somebody has vascular dementia, definitely need to get checked out, work with a Bredesen-trained practitioner. I am positive something can be done. Okay. Yes, the RECODE protocol is great from Dr. Bredesen. A lot of patients who are diagnosed with Alzheimer's are doing his RECODE protocol, but the PRECODE protocol is really recommended for those who are just concerned about preventing dementia. Okay. Sorry, I was not able to share the other photos. That's okay. Somebody had a hysterectomy at age 34. Definitely need to consider bioidentical hormone replacement therapy. I hope you have access to a practitioner who can talk to you about that. It's a must. You want to make sure you are doing that. Somebody asked a question on what are the optimum levels of different markers. That's a very good question. And I did consider if I should have optimum levels of different things, but really that would be really confusing. And also optimum is different for different people. It's different for men versus women. It's different for different ages. It's also different because sometimes a marker is a ratio between two numbers, and the ranges for those two numbers can vary widely. So it's a bit of a challenge. So that's why I didn't share that. But this is something that you should work with your practitioner on. Again, yes, these issues and blood tests, doctors don't know about this kind of care that can be done, that dementia can be prevented. Some of the tests that I talked about, they are kind of not the tests that your conventional doctors will run. So you do want to find somebody who's trained in preventing and reversing dementia. Okay. Okay. Yes, certainly holistic integrative doctors are needed, more of them. More and more are getting trained, but we still need many more. Okay. It's true, you don't just test your TSH, you definitely need to test free T3 and T4. Okay. Okay. Okay, let's see. Okay. There is a question on the impact of stress and trauma on the system. This is a huge, there is a huge impact of stress and trauma on your body. Stress will, of course, dysregulate your cortisol. If your cortisol is high, your glucose will be high. If your glucose is habitually high over a long period of time, it will cause insulin resistance. If insulin resistance is caused, then the IDE is not able to work on dissolving the amyloid. So it's really a cascade that gets set off with stress and trauma. But there's a lot that we can do also. I don't mean to suggest by any means that we can get rid of all stress and trauma through our lives. We cannot. That is just the nature of life. But practices like meditation, community, acceptance, forgiveness, all these practices can come in, gratitude. all these things can make a big difference in kind of reducing your stress. And of course, working with a therapist, working with a counselor, working with somebody that you trust can make a big difference. If there is no Bredesen trained practitioner in your area to work with, I would think that if there is somebody at least in your state, it might be worth making at least one trip to go see them so they can do a physical exam as well as order the tests. We do have patients who will travel from out of state to come see us because they are not able to find somebody near them. We need them to be seen here in person at least once a year, and then we can work with them. The question is, would RECODE be suitable for someone with MCI? Are RECODE necessary at that point? I would say you definitely need RECODE, and do not, please take this very, very seriously. There's a question on how important do you think is a ketogenic diet compared with eating a health supportive, gluten-free, dairy-free, whole foods diet that does include fruit? It depends. With a lot of questions, it really depends on what the underlying picture is. If there is no concern about insulin resistance, if your A1C is under control, then maybe that would be okay. But we really want your fasting insulin to be under 4.5, and there is not a lot of people that have that. So if your fasting insulin is over that, we do think that you would be best served by a ketogenic diet. The cost for assessment can vary. We unfortunately do not take insurance for consults. PPO insurance may be able to be used for some tests, but those are specific questions that the front desk can answer, or specific or practices that you're looking at to get your answers. They can give you these answers. If you had a total hysterectomy due to cancer years after natural menopause, does that put you at more risk? I would say no, but you still want to make sure that you are evaluated for your hormone replacement therapy. There's a question on the importance of utilizing a ketone meter. I think this is really important, especially if you're just getting started. If it's the first time you're doing a ketogenic diet, I would highly recommend that you use a ketone meter so you know that you are definite ketosis. We want to be in mild ketosis from, let's say, 1 to 4 millimolars. We don't need to go super high. Even 1 to 2 would be fine. And once you've used the keto meter for a while, then you know what keeps you in ketosis and what kicks you out. So then you can reduce the use of that. You don't need to use it that much. Okay. Okay, let's see. How do you prevent gasoline toxins? You really cannot prevent. There's a lot of toxins in our environment today. If you buy new furniture, there are flame retardants. If you buy PJs for kids, there are flame retardants in those. If you buy a new car, there are flame retardants. There are gasoline additives everywhere. What we can do is upregulate our body's ability to detox. Right? The human body is basically a giant detox machine. So if we keep it working well, then, and we keep maintaining it well, then we are able to throw back those insults that the environment is throwing at us. So that's really the best thing that we can do. Okay. Are there any medical groups in the Bay Area with their own insurance? I am not aware, but the link on this page, I have this link for out-of-state practitioners, but even in Northern California, you can look to find a practitioner in your location and see how that goes, okay? Do I like continuous glucose monitors? Yes, very much. Especially if you tend to have those cardiometabolic issues. Definitely use it, and then you can kind of see how you are responding to the different foods. A1C is 5.9, far above the 4. The 4.5 range that I mentioned is really for fasting insulin, not for A1C. For A1C, you really want to stay in the 5.5, 5.6 range. And for type 1 diabetic, I'd say that's really good. But for insulin, generally, I mean, I've seen people's insulin at 45, 25. Those numbers need to be much lower. Yes, there's a lot of hope for type 1s. If it's well-managed condition, it can be done. Homocysteine, definitely we need to bring it down. Over 100 is definitely not right. It depends on how long your homocysteine was high for that long. That's a really specific question. Vitamins will definitely bring that down, as you have seen. There may be damages depending on how long the level was that elevated, but I wouldn't be really able to tell without specific details and perhaps testing. The effects of sleep apnea. Could possible low oxygen levels that occur during sleep apnea contribute to dementia likelihood? Absolutely, 200%. If you have sleep apnea and that is not addressed, your brain is not getting the oxygen, is not getting the nutrients that it needs, and you will have complications from this. So definitely need to make sure that the sleep apnea is addressed. And these days, I wonder how many of you are aware that you don't have to go to a sleep center for an overnight study. There are devices that a company can ship to you, like a little wearable on your finger with a little piece that you stick on your chest, kind of like an EEG. And then and there's an app on the phone that it connects to, and it does a pretty good job of coming up with what is your likelihood of apnea. And then that gets interpreted by a sleep physician. And if it's positive, then you can get a CPAP, and all of that is covered by insurance. So that's really good. Okay. Somebody says they're 62 and ApoE44. Where do I even start? Start with finding a Bredesen-trained doctor near you. And super important to do that, right? What is a healthy TSH level? What level is a warning signal? This is another one of those things where, the range is generally 0.5 to 4.0 or 4.5. We like to see it on the lower side, definitely below low. So this is one of those instances where the optimal level is on the low side rather than on the high side. What level is a warning signal? Higher than that would be a warning signal, but we also have to see like a global picture, what's happening. The TSH is being produced by the brain. It's telling the thyroid to produce more T4 and T3, the active hormones. So we have to kind of see what else is going on with this help. The webinar is recorded and you can replay it. Okay. Slightly elevated cholesterol, depending on how slightly elevated that is. Cholesterol over 150 is actually good, contrary to conventional wisdom. You need cholesterol in the brain to be able to manufacture the hormones that you need. Cholesterol is something that, we need to really look at things like small dense LDL, ApoB, and other things like that. So slightly elevated cholesterol, I'm not at all concerned about that. But really, it depends on the actual levels. When someone tests really high on the urine test for toxic non-heavy metals, what are some binders? I'm guessing you mean mold toxins If there are mold toxins, it really depends on what mold toxin that is. If it's ochre toxin, generally we would go with cholestyramine. If it's well tolerated, otherwise Velcro. If it is other things like aspergillus, gliotoxin, zearalenone, stachybotrys, you might do other things like maybe GI detox, chlorella, charcoal. It depends on what species are elevated, how elevated they are, and what else is going on. Rocket fuels, well, it depends. For that, I would generally do things like sauna, super important. Things like high levels of B3, niacin, that'll help. So that makes a big difference. Okay. Okay. Just want to see if there's anything I missed. We talked about the value of nutrition, exercise, and sleep. The Bredesen, yes, that is the right spelling, 2.0, 2.0 protocol. Just do a Google search. There is a link on this page that I'm showing for a practitioner locator. It's called, his company is called Apollo Health. So look for Apollo Health, you'll be able to find it. A replay link to the webinar will be sent to everybody. Okay, I think I have addressed most of the questions. Those are specific questions about blood pressure, systolic, diastolic. It depends on what else is going on. You know, we want to make sure we have all the information before I start answering specific questions. So you really should see a practitioner for that. Okay. Okay, so if no other questions, I will go ahead and close this here. Again, you have the information about, let's see. Okay. Okay. Yes, so if you are doing KetoFlex, there was a webinar done by Dr. Sanderson not too long ago. You should look for that. You should have a copy of that. Okay, so again, you are welcome to reach out to our front desk. Our phone number is right here on this page. The website is right there, soulseri.com. The phone number is right there. And if you want to look more into Dr. Bredesen's work, look on apollohealthco.com and you'll be able to get this information. It was lovely to talk with you today and answer some of your questions. Again, any questions, reach out to our front desk, send an email. Otherwise, I will see you at the next webinar. Thank you.